back. You're watching Startup Central with me, Nayantara Rai. It's been one of the worst days ever for Dalal Street, being called the Lal Street. And on Startup Universe as well, we're seeing some amount of fears. What's going to happen going forward? Sequoia Capital talking about COVID being the black swan of 2020. What we've also been discovering on this episode of Startup Central is how stakeholders are rising to the occasion, be it, for example, with edtech companies coming out with free classes for students. Remember, schools and colleges being shut down, not all over India, but certainly many of them across urban India especially are considering the move. And we've seen edtech startups really rise to the occasion. What's happening at the healthcare startups? Let's check in with Vishal Sehgal, the medical director at Porthia Medical. Hi Vishal, thank you so much for joining us here on Startup Central. You know, I think one of the biggest buzzwords you have today in the world is social distancing, right? Don't stand close to someone, all of that. Now, anyway, cinema halls are being shut down, etc. The fact is that given the fear of coronavirus, at least in urban India, a lot of people are scared. Gone are the days when you said some bless you to someone who sneezed. What's it been like at Porthia?
Yeah, so with this, coronavirus coming in and the awareness that, social media and other media channels have created around it, more and more people are avoiding to go to crowded places. Now that includes hospitals and healthcare organizations too. So if we go to any hospital now, you'll see the OPD numbers dwindling, the elective surgeries down to the lowest minimum possible levels. It's only those who are majorly sick or need, ICU care. Those are the people who are venturing to the hospitals. As a result of this, we've seen in the past week or so a sudden spurt in, calls that we as a home healthcare provider are getting, whether it's for doctor consults or whether it's for the rehab services, because post surgeries, say total knee replacement, hip replacement, and a whole lot of other chronic diseases like low backaches and cervical spondylosis, people or patients who have been undergoing rehab services in hospitals are coming to us and asking us if we could provide the same at home, which we do. Likewise, short-term nursing services, injections, vaccinations, and I said in-house, doctor consultation, even for minor illnesses. And post-consultation, even minor procedures like IV infusions for antibiotics or IV fluids for dehydration, etc. We're getting more and more calls for these. In addition to a lot of lab work which we do, so we pick up the samples from home. Patients are scared and their families are scared to venture into hospitals for these services. So all the minor ailments, whatever can be managed outside the hospital, we've seen a sudden spurt of about 25 to 30% in the past week or so.
You know, but Vishal Sehgal, I got to ask you this: your entire business model also depends on partnering with hospitals, right? So if people are going to be fearing to go to hospitals, or if you're going to have a sudden surge of cases also in hospitals, where does that leave you?
Okay, so we do partner hospitals and we have tied with 60 plus tertiary care hospitals pan India. But we never say that we are substitutes to hospital. We cannot substitute hospital care. Once the patient is hemodynamically stable or the interventions have been done in the hospital, that's the time we are ready to get the patients home. And this is mainly for chronic disease management or long-term ailment or for very minor, issues like just an injection, etc. We never want to, substitute our services for a hospital. That can never happen. So even when we say we have ICU at home, it is for those patients who have a prolonged case, and it may take many weeks or months to recover, maybe ventilator dependent. How long can such patients stay in the hospital? They may acquire hospital-acquired infections. Plus, the economics doesn't make sense for them to stay in hospitals for this long. We get in such patients, set up step-down ICUs at home with the entire gamut of devices and the services, whatever are required, and take care of such patients. So we complement the services of the hospital and we help hospitals vacate their beds to take in more acute patients rather than competing with them.
Then I've also got to ask you this question: that what is Porthia doing to make sure that all the staff, the support staff, the nursing staff, the doctors and all of that that you send to people's homes are also free of COVID? We talk about social distancing. Don't go to movie halls. Don't be within 6 feet of someone who has a cold. Don't be in an elevator when you can use stairs. How are you ensuring that your nursing staff is also free of COVID? How are you ensuring that your medical staff is free of COVID?
Right. So that's the first ask that we're getting lots and lots of queries, not only from new patients, but the existing patients where our nurses are there. The moment there's a change of shift for a 12-hour nurse, the patient says, what guarantee is there that when the nurse comes in, she would be COVID free. So apart from the education, the training that they've undergone in the past couple of weeks, and every single day we are doing the same. Plus the use of personal protective equipment, maintaining respiratory hygiene, hand hygiene, respiratory hygiene. Those are the things that we are educating them, and we are ensuring that they adhere to that. And any healthcare provider or worker, if has any sort of symptom like fever or cough or cold, we take them off duty. So we are ensuring that only the healthy get into it. We are also taking detailed history of who these patients have been working with in the households. If there is any history of the family traveling outside India in the past few weeks, then we do we quarantine, we remove the staff. So there are a lot of steps in place that have been put by us. Also, we started for the customers or for the patients, we started a 24 hours helpline where they can reach out to us and FAQs can be answered. In addition to this, we've constructed a website which takes care, or which is updated daily or many times a day on the do's and don'ts, FAQs, what they need to do, to ensure that they are aware of what really COVID is all about.
So can you tell me a little bit about that when it comes to the FAQs, the 24/7 helpline? Of course, the government has one. You're also not the only one. How has Porteous done? Did you think it would do as well as it did, or do you think that because of the internet it hasn't done that well? Can you give us a little access, because through you we're trying to just understand what really is happening out there?
No, though a lot of awareness has been created, in the media, in the the social media, and otherwise everywhere, everyone is talking about it. But we were surprised. This was, I think, about 10-12 days back when there were calls that we got, our call center, and they asked how to quarantine. They said, should we move on to a hotel? That was one of the patients who called us, to quarantine. So the basics probably were not in place. That is when we thought, we may not be able to do something for the larger population, but our own customer base, our own database of, 100,000, many 100,000 of customers, at least we could reach out to them with links, etc., and communication via emails, SMSs, etc., where they could reach out to us, and plus links which would answer a whole lot of questions based on WHO guidelines, based on Government of India guidelines, CDC guidelines. So all is there, and we made it more simpler for them.
Okay. And with that, Vishal Sehgal, I'd like to thank you for being a part of Startup Central. That's Portea Medicals for you, telling you about the spike it has seen, the surge it has seen, the basic concerns that it has seen when it comes to COVID. We're minutes away from Wall Street opening. The futures are indicating a massive cut. We're going to take a short commercial break, wrap up Startup Central so that news at 7 p.m. can begin on time, and let's see what happens at opening bell.